Well, very interesting report there by our business team. Well, the Ghana Revenue Authority wishes to inform you, especially persons registered for value-added tax, that's VAT, that the Domestic Tax Revenue Division has commenced the implementation of an electronic invoicing system of VAT referred to as EVAT. This involves integrating the invoicing systems of VAT-registered taxpayers to the Commissioner General's invoicing system. Taxpayers who do not have an invoicing system will be required to issue invoices using GRA's certified invoicing system at no cost. VAT-registered taxpayers are to note that refusal to integrate their invoicing systems with the Commissioner General system attracts sanctions. Kindly contact the GRA's toll-free on 0800 900 110 or via these numbers on WhatsApp 055 299 0000 or 020 063 1664, and that's how you can get all the information that you need. Well, this morning I'm here to give you some information about a COVID-19 mass vaccination exercise. Yep. Well, I'm sure many of you thought that COVID was over and we are seemingly out of the woods as compared to what it looked like 2 years ago at this time. But there's a need to have this vaccination exercise, and Dr. Margareta Gloria Chandi, Director of Health for the Gan West Municipal Area, is here to explain to us why it's important. Good morning to you. Thank you so much for joining us, Doc.
Good morning.
Good morning. I mean, now all we hear on the radio is economy, dollar. It appears that COVID is being pushed away. We are not hearing about the infections as much as we heard of it about 2 years ago around the same time. Why is it important to have this mass vaccination exercise?
Well, COVID never went away. We only relaxed the rules because the infection rate got down. And you and I know that COVID is seasonal somehow. COVID usually comes when there are festive occasions, when people get together, and Christmas is coming, so we know COVID is also coming. We never stopped having cases, except that the cases went down. As I'm speaking, it looks like today we have 9 people on admission. We have a few who have been discharged, and you know our reporting system is bad, so there are a lot more walking about. We don't know,
and there could even be asymptomatic people.
Sure. And then, vaccinations work on a certain principle, what we call the herd immunity. So if there are about 100 people in a room, and then about 90 of them are vaccinated against a certain disease, the 90 shield the other 10 from having severe form of the disease. Although the 90 can still get the disease, they will not suffer as people who don't have. And looking at Ghana, if 90% of people in Ghana are able to vaccinate themselves against COVID-19, then forever we'll be free. But it's not like that. We have hesitancy. So it's just about a few people who have been vaccinated. I think about 38% of the population has been vaccinated. So we have a long way to go. And we want to capitalize on this festive occasion when people will be coming with the COVID, so that we're prepared to meet them.
I think that's a very proactive initiative, and you need to be commended for that. But tell us the period of this mass vaccination exercise and how long it will take.
From 14th to 18th December, that is within this few 4 days. But COVID-19 vaccines are always available. At any public health facility, you'll get COVID-19 vaccination there.
So if there's an organization or a group of people who want to take advantage of this mass vaccination exercise, how do they go about it?
Oh, that would be very good, because we want people to come out. Just see the municipal director in charge of that area, and everything will be sorted
So
out.
this is nationwide, right?
It's nationwide.
So wherever you are watching us, if you are a group of people or if you are someone who owns a company, runs a school, it's important to also note, Doc, that now we are given vaccines 15 years and above, right?
Sure.
So if you run a school and you want to take advantage of this mass vaccination exercise, what Doc is saying is that just contact your municipal health director wherever you find yourself and they'll be able to assist you. So Doc, even on the bit of 15-year-olds taking the vaccine, we know when it started, there were some exemptions, pregnant women, breastfeeding women. It's important to explain why they can now take it.
Yeah.
Can you help us with that?
Yes, you know, people were complaining, this vaccine, we had it too quickly. The period is too short. But due to technology, we were able to overcome to get the vaccine. And due to technology, we have now found that other categories of people can take the vaccination. So those who are 15 years and above, whether you are pregnant, whether you are breastfeeding, you still can take COVID vaccination. Initially, we didn't know what some of the signs and symptoms were or the side effects were. So we exempted pregnant women and then those breastfeeding because they are the critical people. But we realized that pregnant women even need it more because if you get COVID whilst pregnant and you have to lose your life, you lose 2 lives. But with the vaccine, you'll be able to overcome the infection. So we've realized that pregnant women can also take the vaccine. And there's also this issue about expiry dates. In the initial stages, the periods that were given for the vaccination, further studies have proven that it can go beyond. So let's say if initially Johnson & Johnson is expected to expire in 3 months, additional days have been given. So if you see any material about the prolonged expiry date, it's not deliberate. Research has been made and it has been extended. So we are still, researching. Anything that comes, we'll let the general public know. It's interesting. We are in that season where the weather gets a bit dry. There appears to be flu in the system. You've mentioned that we expect a lot of visitors around this time for Christmas, relatives outside the country coming in, expats coming in for tourism and all that. What should we be looking out for to ensure that we are safe during this period, even if we are vaccinated? Yeah, you know, surprisingly, COVID doesn't show its traditional signs anymore. You could be having just some light headaches. You could just be feeling uneasy. But when you test, you are COVID positive. So the best thing is, let's ensure that those who come, at least we quarantine them. They could be in the house, but let's minimize our interaction for the first 2 weeks to be sure. And let's find out whether they're vaccinated. Of course, they'll be vaccinated before coming. Otherwise, they will not be allowed on the aircraft. So let's just be mindful that COVID is still with us. And when we go into and all the precautions, events, all the precautions, washing of our hands. As for social distancing, that one is missing from our language, but it's very important, very, very important. And also, when we are in crowded places and people are showing signs of flu and other things, let's tell them to stay at home. If you have flu, there's no need coming to town to infect people. Just stay at home, especially children who go to school with flu and all other things. I like that you've mentioned that, and probably that will be another conversation because I know it happens elsewhere where when children have the flu, they don't go to school. They stay at home. But here, it appears as we become so used to it. Oh, it's just a cold. Yeah. And then we send children out to school. And it's like the baptismal certificate for every new child who goes to school. Once you go to school, you come home with a flu. We shouldn't be. And sometimes it's not just once or twice, it keeps happening and recurring. So it's important that you mention that. Well, so this morning, and this is just by way of information for you to know that there's a mass vaccination exercise for COVID happening between today, which is the 14th, to
the 18th of December. You need to take advantage of this. If you're a group, an organization, and you would want any help in doing this, just contact the municipal director where you are. But what if I'm an individual? How do I access this? Do I just walk into a hospital, a public facility?
Any public hospital should be able to sort you out when you get there.
But will we see movement, like during the
We'll be moving from house to house.
Okay.
We'll be moving from house to house. I think this year, almost every now and then, you see people moving from house to house with COVID vaccine and all other types of vaccines. So when you see us in your homes, it's not fake. We are Ghana Health Service. The people who care for you, you are the egg in our emblem. So we are going to take good care of you.
That's a very wonderful way to end this conversation. An assurance from Dr. Margareta Gloria Chandi that you are at the heart of everything the Ghana Health Service does. She's Director for Health at the Ghana West Municipality, and she's been sharing with us details of the mass COVID-19 vaccination exercise. Any other words, any other thing you'd like to share with us?
Yes, let's be mindful of the herd immunity. That is very critical for COVID. If we want to surmount COVID, then we must have the herd immunity. And the vaccination should be within the shortest possible time. The more you drag, the more other strains come in. So let's all give in to this COVID vaccination. You see, vaccines, children have received vaccines from their infancy. I received full doses of my vaccines. Nothing has happened to me. My children have. COVID vaccine is a vaccine. It's not different from any other vaccine. So let's put the hesitancy aside and let's see Ghana move forward.
COVID vaccine is not 666. It's not the new world order, we've been hearing from some conspiracy theorists. Let me thank you once again for joining us. So do just take advantage of this mass vaccination exercise and get yourself and your family protected. Right, shortly we'll be getting interactive with you. Benjamin Akapo will join me. But let me just inform you about the Adum TV Festival of 9 Lessons and Carols. Is happening this Sunday at the National Theatre at 7 p.m. You don't want to miss it for anything. It's a rib-cracking fun reenactment about the birth of Christ from your favorite Kumawood stars, Matilda Sari, Dada Santos, Michael Afrani, Awoya, Otele, Kolege, Atemuda, Salinko, Shefo, Don Leto, Wayosi, and many more. Who would play Baby Jesus, Mary the Caretaker, Joseph this time round? Well, it's only one show featuring performances from Soul Winners, MOG, and the Ikuya Achere Memorial Youth Choir. The ticket is going for a cool 30 cedis per person. To get your seat in advance, just use our digital sales platform. Here's how to buy your ticket. Use the short code *713*003#, select 1, then select 2 Adum TV Festival of 9 Lessons and Carols to buy your ticket from the comfort of your home. It's going to be a night of fun with your favorite Adum presenters at the National Theatre of Ghana on Sunday, 18th December 2022 at 7 p.m. Our sponsors are Yamvita Infant Cereal with Milk, ADB, Truly Agric and more, Mansoa Herbal, Just Say Wamba, Franco Trading Enterprise, Phone Papa, Any Printers Papa Fee, Mikado Conference Center, Service Unlimited, 11-2 Feminine Wash, Stay Fresh to Impress, Calipo, Abi you know data, Midima for Herbal Clinic, Oyare for Wudima for Nehwa, CD Low Price Masters, Durable and Affordable, Tumira Herbal Center, Ayarisafi, Rockstars Roofing System, the key to all your roofing needs, Duffy's Health and Beauty, the Hand of God, Kwa Mixture, the medicine that works, Compu Ghana, Passion for Technology, KFC, It's Finger Licking Good, and Kimonsi Ventures, the Pride of Africa. Do stay with us. We'll be back shortly to get interactive with you.